Good morning, friends. This is Dr. Vinod K.Mishra from Gastro Hospital, Swarupnagar, Kanpur. At the outset, a request. This is a scientific deliberation. I would certainly request you to subscribe to this channel and share this video so that this information can be sent to a majority of the population. Today, I'll be discussing about how to differentiate chest pain which is coming from the heart and the chest pain coming from GERD or gastroesophageal reflux disease. So we will be assessing the symptomatology, we will be assessing about the management, and we will be talking about the science behind the chest pain in angina and the GERD. Now, chest pain is one of the things which makes you worried. It makes you worried mostly about the heart attack. You always think that I have a chest pain and possibly I have a heart attack. Now, the chest discomfort can also come from the esophagus, that is the food pipe, because of the GERD, which is known as non-cardiac chest pain. That is what the American College of Gastroenterology says. Now, as far as the non-cardiac chest pain is concerned, it can mimic angina. You need to learn, you need to distinguish between angina which is coming from the heart, and you need to understand the non-cardiac chest pain which is coming from the esophagus, so that you become comfortable, reassured in the middle of the night if you have chest pain. Now, location of the chest pain is one of the very key factor which you need to understand. As far as the cardiac pain is concerned, it can come in the middle, but mostly it is on the left side or the precordium. Once it is there, it will be felt here, but it will move from here, which is known as radiation. As far as the radiation is concerned, the chest pain coming from the heart can radiate to the upper limb, it can radiate to the jaw, it can radiate to the shoulder, it can radiate to the back. So, if that is the kind of radiation which you are feeling, it is most likely that you are having pain from the heart. But if it is coming from the esophagus, what you will feel that it is coming from the back of the sternum, that is the bone which is known as sternum. It is felt in the epigastrium also, that is below the sternum. Now, this pain usually is accompanied by burning sensation. If you have the burning sensation also, it goes more in favor of a pain from the esophagus. It does not have any radiation to the left upper limb. It does not have any radiation to left shoulder. So, it does not have any radiation of this kind and staying here only. It is possibly the pain which is coming from the esophagus. Now, the third entity, basically the esophageal spasm. I want you to understand this. It is basically the tightening of the esophageal muscles and sudden twisting of the esophagus which brings out this pain. This may be part of GERD or gastroesophageal reflux disease, but it could be an entity on itself also. Here also, the chest pain will be here. It can go to the throat. It can go to the back actually. It can go to the back in between the both scapulae, and you will feel at the back also. You can feel back. You can feel pain in the epigastrium also, and at time you will have a feeling of dysphagia that you want to swallow something and you are not able to swallow. Now, how does the chest pain feel like? How do you differentiate? When it is coming from the heart or the cardiac chest pain, you need to watch the symptomatology. The feeling of the chest pain would be that's a crushing type of pain. There's a very severe pain and the feeling of crushing is there. You will have that feeling that's a searing kind of pain, that is something is basically getting torn. Then you will have a feeling like tight like vise, and heaviness would be very prominent feature. You will feel that tons of weight has been put on your chest like an elephant is sitting on your head. That the kind of heaviness which you will feel. And at the end you will feel that the pain is coming from deep inside and coming in the front. That is what the pain of the cardiac origin comes. But as far as the pain of the non-cardiac chest pain or GERD is, that you need to understand that it's a temporary kind of pain. It will be very severe. The only thing is, it certainly has relation to the breathing. You take a deep breath and there is a change in the intensity of the pain of the non-cardiac chest pain, and that's one of the very, very differentiating feature. If there is a change in the intensity of the pain with the deep breathing, it is unlikely to be a cardiac pain. If there is a change with the deep breathing, it is likely to be a pain of GERD or non-cardiac chest pain. The intensity level of the cardiac pain stays same. It depends upon the kind of cause you have as far as the chest pain from the heart is concerned, but the breathing does not really change the intensity of the pain of the heart. Now, reflux related chest discomfort basically is less likely to feel very deep. It usually is felt as superficial and it is more close to the surface rather than feeling deep. Now, how the position of the body affects the symptomatology is very important. As far as the GERD is concerned, what the science feels that if you straighten your body, you will start feel better. If you move your body, you start feeling better. But if you bend forward, the food comes into the mouth or the acid comes into the esophagus, so that your symptoms basically worsen. So if you bend forward, the symptomatology of the GERD is likely to worsen. But as far as the cardiac pain is concerned, the science thinks that regardless of the change in the position, there will be no change in the intensity of the pain. The pain may go and come on its own, but as far as the intensity is concerned, positional change will not affect the pain at all. And if you have an attack, then the pain is likely to worsen over a period of time and likely that it may become worsened. Now, associated symptoms become one of the important issues and I want you to understand. Now, if you have a cardiac pain, what are the other associated symptoms which are likely to come? You can have lightheadedness. You can have shortness of the breath or dyspnea. You can have dizzy feeling that you may fall. You will have sweating and you may have profuse sweating and you become absolutely drenched. You may have nausea, at times vomiting, but not really very common. You can have numbness in the left upper arm or in the shoulder, which is quite common. But if you have pain which is coming from the esophagus or GERD, you can have other symptomatology. If you want to swallow something, it is quite possible you will have difficulty in the swallowing, which is known as dysphagia. Now, you can have burping or belching if it is coming from the esophagus. You can have burning sensation in the esophagus or in the throat if it is coming from the esophagus. And at times, you can have sore eructations or sour taste in your mouth if it is basically part of the GERD. There are certain other types of also chest pain which I want that you should keep in your mind, because they can also mimic at times the pain from the heart or from the GERD. If there is a blood clot in the lungs, which is pulmonary embolism. If there is a costochondritis, there is inflammation of the costal margin. If there is any broken rib because of the trauma. If you have very high accelerated hypertension, it can give rise to chest pain. If you have a panic attack and severe anxiety, it can give rise to chest pain. If you have gallbladder stones, which is giving rise to biliary colic, it can confuse with heart attack or with gastroesophageal pain. You can have pancreatic pain because of any reason which can get confused with the heart attack. You need to understand this. At times, the asthmatic attacks in the beginning basically behaves as a pain which is coming from the heart. So these are other problems which you need to understand, that they can mimic a pain either from the heart or either part of the non-cardiac chest pain. Now, once you come with the pain in the chest to the hospital, what do we do? How do we diagnose? If I am suspecting that you have a problem which is related to heart, the basic investigation which will be required are that you would require an ECG, that is electrocardiogram. You will require an X-ray chest to look into that what is the size of the chest. You may require a stress test or TMT, or that is treadmill test, to look into that what is the working capacity of the heart when you basically do an exertion. We may require a 2D echo. This is a kind of ultrasound of the heart to looking into the structure and the functioning of the heart, that how are the valves are there and how is the ejection fraction or the pumping capability of your heart. You will require a TROP-T, which tells you whether you have a recent attack or not. Some blood test may be required, but at the end, friends, if I am suspecting that you have a cardiac problem, it is basically the coronary angiography which gives us the complete answer whether you have a cardiac problem or you do not have a cardiac problem. Now, if you come with the chest pain and I am suspecting that this may be part of the GERD, then what do? I conduct an upper GI endoscopy which gives me a ready diagnosis. I can go for 24 hours pH monitoring to look into that how much is the acid inside your esophagus. I can go for esophageal manometry to look into that what are the pressure in the esophagus, are they the reason for the pain. I can go for a barium study in which a barium examination will be done of the esophagus, although it's not very commonly required. At times, if I am suspecting that the pain may be coming from gallbladder or pancreas, then I may go for an ultrasound to look into are these structures normal or are they not normal. Now, what are the things which may be offered as part of treatment. As far as GERD is concerned, as part of the treatment, the first thing is the proton pump inhibitors. These are the ones which are very effective as far as the suppressing acid is concerned. You would require certainly dietary changes. You need to stop fried foods. You need to stop spicy food. You need to stop citrus fruit so that acid production is reduced and so that esophageal symptoms are taken care of. You need to stop all those trigger foods which are creating the problem. You would require some lifestyle changes, including exercise and weight reduction, because these are the ones which are very responsible for GERD. Now, you need to avoid any tight fitting clothes which put extra pressure on your abdomen and push the things into the esophagus and create the problem. Now, if I am suspecting a cardiac pain, I'll advise you that you need emergency care henceforth. You need to go to emergency immediately. Depending upon your symptomatology, the treatment would be tailored. The basic cardiac problem would be looked into, whether this is angina, acute myocardial infarction or acute coronary syndrome. Depending upon these situations, your investigation and treatment both would be tailored so that it's taken care of. If you think that this video was educational enough to differentiate between a cardiac pain and non-cardiac pain, to understand in the middle of the night, to make you more comfortable, then do subscribe to this channel and share this video so that this information can be sent to the majority of the population. This is Dr. V.K. Mishra from Gastro Hospital, Swarupnagar, Kanpur. Thank you very much.